Welcome to Continuing Mobile Education for Emergency Medical Services Providers. This is Special Considerations, Episode 2, Apparent Life-Threatening Events. After viewing this episode, participants will review the presentation of ALTE. Participants will also review the disease processes which can cause an ALTE. Finally, participants will review the pre-hospital management of ALTE.
ALTE is an abbreviation used for Apparent Life-Threatening Event. It represents a subgroup of patients in the age of 2 and under generally, which is basically a frightening experience for the caregiver or person that's with the pediatric patient. It goes along with symptoms such as periods of apnea, change in skin color, cyanosis, for an example, respiratory distress, whether it be a short-lived episode or whether it be something that's still presenting when EMS gets there. Altered mental status, anything that basically frightens the caregiver as far as being an acute and serious event, even though it's may be self-resolved when EMS arrives.
Well, we really don't know what causes ALTEs. We have some thoughts of what some of the risk factors are. For example, we know that ALTEs occur more often in impoverished families than they occur in more well-to-do families. We know that it occurs more commonly in mothers who've had lack of prenatal care. We know that it occurs more often in moms who've used/abused illicit drugs. We know it occurs more commonly in moms who smoke. We have some theories as to what might be causing ALTEs, but none of them have actually borne out as to what what we could in essence do to really impact the ALTEs.
The causes of ALTEs in many cases are unidentified. In other cases, it's a symptom, it's presented because of an underlying illness or etiology. Maybe a CNS defect, cardiac problems, respiratory infections, swallowing disorders, developmental disorders that may be an issue. So there's a multitude of things that can present as an ALTE. It could be as simple as a febrile seizure, or it could be more complicated into a multi-system problem that maybe it hasn't been recognized or is under treatment at that point. But the recognition of the ALTE is it can't be understressed. It needs to be taken seriously, even though the patient might present completely normal physical exam when EMS arrives.
Some of the things that we would look for when children are brought to the hospital with an ALTE, again, as we alluded to in the first session, is by all means sepsis. I can't state that any louder or any more emphatically. With a capital S, sepsis is by far the leading cause of an ALTE, and oftentimes we will pursue that fairly aggressively. Other issues that we look for, certainly seizure activity. Other more common, for example, reflux, gastroesophageal reflux disease. As the child, basically your reflux formula, which is very common in the neonatal period. It causes them to briefly have some cessation of breathing, usually fairly brief. Probably it's mediated by the vagal nerve. Possibly it's meant to prevent aspiration of formula and gastric contents into the lung. But those are some of the things that we'll look for. But in the pre-hospital environment, obviously managing the airway, breathing, circulation, and certainly highest on the list would be concern for sepsis.
ALTEs, or apparent life-threatening events, are most common in children 2 and under. It can include periods of apnea, and symptoms can resolve. It is unknown what actually causes ALTE, but is often seen with sepsis. Literature has identified a variety of risk factors for ALTEs.
If we can't identify a cause for the life-threatening event in the emergency department, and sometimes we can, sometimes we can't, we might be able to, for example, say, hey, this child actually had a fair amount of formula that came out through the nose, and pretty significant clear-cut case of reflux. We may, with a family who has access to transportation, telephone, we may elect to monitor that kid at home. On the other side of the coin, an ALTE, or life-threatening event, both is anxiety-provoking for the family. It's certainly anxiety-provoking for the healthcare providers who take care of the baby. And we're always concerned that once a child is brought in with one episode of stopping breathing, of apnea, that there may be another episode that could occur oftentimes within hours, sometimes days. And because the possibility of long apneic episodes causing both long-term ischemic problems in the baby with neurological residual, or possibly worse, which is death, we prefer to manage these babies in the hospital where they're monitored with an apnea and bradycardia device.
There has been a couple of cases where the parents feel embarrassed when they call for an ALTE event. When the EMS gets to the scene, then everything seems to be fine, and they've really not wanted the patient to be transported. I think this is where the education for the EMS side comes into play, because it certainly has in a couple of cases where by educating the parents that these might be presentations of underlying illnesses and a need for evaluation by the pediatricians and emergency staff. A lot of it comes down to the education of the parents and their understanding of what the importance is for the continued evaluation, and not for us to underestimate it as EMS providers.
ALTEs are very serious, and patients need to be observed for subsequent episodes. Symptoms can resolve by the time EMS arrives, and it's imperative these patients be evaluated in a hospital. EMS should educate the parents about the situation and possible outcomes.
Pre-hospital management, obviously you're going to take care of the presenting problems if they're still there. If the patient periods of apnea, certainly for an example, it might be a case where you prepare for that event to occur again. Many ALTEs present fairly normal physical exams when EMS arrives. So the routine medical assessment and physical exam would be performed and treat any presenting complaints that may be treated. Again, it may be a matter of just monitoring the patient to the hospital because often these signs and symptoms have subsided or self-resolved before the EMS even arrives. Again, history is important for determining what went on that precipitated the call for EMS. That information is very important. Information leading up to it, previous events similar to those episodes.
Again, the pre-hospital considerations for an ALTE are still paramount. Addressing the airway, breathing, circulation, dextrose, which we alluded to before, and trying to keep the child at least isothermic. There aren't very many other things that can be looked at in the pre-hospital care, although if the pre-hospital care provider thinks that the child may be seizing or having convulsive activity, that would be important to transmit to the healthcare providers in the emergency department. It would be helpful when the pre-hospital care tells us something about the social milieu, the environment where they pick the baby up, because there are issues, for example, of poverty that make us more apt to admit the child, issues of concern for abuse that would, for example, a shaken baby, which might be associated with an ALTE, that we would like to address. And the pre-hospital care providers, I think, get a better feel for that because they actually see the home environment.
I think the biggest pearl or tip for EMS would be not to underestimate the presenting complaint, whether it's present or absent at the time of your arrival. ALTE complaints need to be taken seriously, not to be underestimated, even though those signs or symptoms might be absent when you arrive. Particularly in areas where you have extended transports, where you may have a 25-30 minute transport time or longer, that becomes even more important, even if it's just attending the patient for continued monitoring in the absence of any other intervention you might do. Certainly it needs to be considered as a potential life-threatening event as the initial symptoms would present itself.
The pre-hospital management of ALTEs include addressing presenting problems such as apnea, routine physical exam and history, the ABCs, keeping the patient euthermic, and preparing for subsequent events to happen. After viewing this episode, participants will review the presentation of ALTE. Participants will also review the disease processes which can cause an ALTE. Finally, participants will review the pre-hospital management of ALTE.